guys. Awesome. Okay, so again, welcome, and I'm really excited to be here today. I'm really excited to be working with all of you in Santa Cruz County. And before we get started on today, I wanted to do some introductions to all of you. We have Jessica Randolph on the line, and Jessica Randolph is most recently our Public Health Program Manager, recently promoted to Director of Administrative Services. For the last few months, she has been helping the agency develop our strategic planning process, and she's also been doing some work on continuous process improvement on the countywide strategic plan, and helping with some of those operational efficiencies across the agency. But she is the internal lead for HSA on our strategic planning process. And then I also want to virtually introduce Galen Ellis, Jessica Lime, and Shannon Eli. They're strategic planning consultants for us, and they're all members of Ellis Planning Associates Incorporated. And I had the pleasure of working with them in previous iterations when I worked in Plumas County, and they helped us through our strategic planning process there. So welcome, everybody. So what we're going to talk about today is we're going to do two things. The presentation will be divided in two sections, and the first section is the planning landscape. So I'd really like to talk with you all about why are we developing a strategic framework for our agency, and what else is happening, meaning what's the current planning landscape that's happening both within our agency and all around us. Then I'm going to turn it over to Galen so that she can talk about the actual planning process itself. And she's going to define for us what is a strategic framework, how's that different than an actual strategic plan, and what are some of the ways that we're putting in place so that we can get as much staff engagement and input as possible. So to kind of give you a quick lay of the land and background of where we are, we have a health services agency that's made up of 5 different divisions: public health, behavioral health, environmental health, clinics, and administration. And of our entire agency in these divisions, in terms of strategic planning, we do not have an agency-wide strategic plan, but we do have some strategic plans within our divisions. Public health has one. Behavioral health has their mental health strategic plan that is a 2-phase, 3-part plan. We have a substance use disorder 2014 to 2019 plan. And although the Environmental Health Division and clinics haven't conducted any specific strategic planning, they do have, all of our divisions have separately identified missions and visions, priority needs, and goals. So that's our internal backdrop. The backdrop for the county overall, as you all probably know, is that the county has its first ever 6-year strategic plan. And this includes a continuous quality improvement initiative. And some of you might have been involved in being in a focus group or filling out surveys for the countywide strategic plan. Some of you also might be involved right now in operationalizing that strategic plan. You might be part of a continuous process improvement work group or some other efforts. So what we're trying to do, our aim, is to develop a comprehensive strategic framework for the agency as a whole so that we can align and engage all of the divisions and all of the staff in aligning our priorities with the agency priority focus areas. What we're not going to do in a strategic framework is identify objectives, goals, actions that we're going to measure, but we're going to set the stage for our strategic planning. So I'm going to go into talking a little bit about how we set that stage and how we get informed by it, by the current planning landscape. And then as I go along, I encourage all of you to use the chat box to ask questions or ask for clarification, and then I'll be sure to answer them once I've gotten through this portion of the presentation. So the other things that I wanted to say is that you can download everything that we're talking about in today's presentation And if you look at the bottom right-hand corner, there's a little box that says files you can download. So all of those are there. And then just this afternoon, I talked with Jessica about working to get all the materials that we present throughout this entire planning process in a spot on the HSA intranet. So we want to make sure that whether or not you attend any of the strategic planning sessions, that you have a chance to review information and have some feedback. So once I catch you guys up on the current reality, what are all the pieces we have going on in our planning landscape, I'm going to turn it over to Galen, and she's going to talk about the specific steps in our own planning process and what's coming up. Okay? All right. So what are we doing? Our planning process is meant to build on what we already have. It's not to start something new or give us more work, but to take a look at the good assessment and priority setting that we've done across many areas of our work and build upon that. So we have a county-wide strategic plan that I talked about briefly, mental health, our alcohol and drug program strategic plan, and then our public health strategic plan. And for those of you in the agency who might work on grant-funded programs, there are also numerous other kinds of plans that we have. For example, we have a 5-year maternal child adolescent health plan. We have a 3-year tobacco scope of work plan. We have nutrition education, our NEOP funding, nutrition education and obesity prevention, is a 3-year plan. So we also have those as well. And they're really, really important to inform the work that we're going to do in the future. And what I hope is going to happen is once we have a county, an agency strategic plan that rolls up into and aligns with the county strategic plan, that when it comes time to do those 3- and 5-year scopes of work, as well as our divisional strategic plans, that they can all be moving towards the same direction. Okay, so just to give you an overview of what we have already, the Santa Cruz County Strategic Plan was approved in June, this past June, by our board, and our vision is that Santa Cruz County is a healthy, safe, and more affordable community that is culturally diverse, economically inclusive, and environmentally vibrant. And our mission is to have an open and responsive government, and that we deliver quality, data-driven services that strengthen our community and enhance opportunity. When you look at the 9 values that came out of that process, I think it's clear that each one of those would likely resonate strongly with each and every one of us in the work that we do in Health Services Agency. The plan, this Santa Cruz County Strategic Plan, has certain focus areas, and the 6 focus areas are comprehensive health and safety, sustainable environment, dynamic economy, attainable housing, county operational excellence, and reliable transportation. I'll go into those a little bit more at the end, but I'm just setting the stage for the countywide plan that's kind of like our mothership. So the other piece of what informs the work that we're setting out to do right now is information that we got from an HSA employee survey. So the employee survey was done for a couple of different reasons. For me, as someone brand new to the county, and I think at that time I wasn't your permanent director yet, I was serving in an interim role. It was important for me to get a pulse on the agency, have a check-in with staff, and try to get an understanding of where are some of the gaps that we could do better to serve our employees as an agency. The other piece of it was that I hope that in the future we're going to do some concerted effort on workforce development. And this employee survey helps us identify those areas of weakness that we could address. And if we do it every year, we can see if what we're doing makes a difference. But specific to strategic planning, there were some questions that I think will help inform our strategic planning process. So there was a question to employees about HSA mission and goals. How many of you are familiar with our mission and goals? So the vast majority either agreed or strongly agreed that they were familiar with our goals, which is nice. But I think that what informs us even more are the comments that came out of that question area. So some of the comments that we got were that the mission and goals tend to be really health and healthcare focused and didn't necessarily address some of the regulatory goals of the Environmental Health Division. So that's an important note because we are an agency made up of very different divisions that provide different kinds of services, but all for the health of Santa Cruz County. Another really informative comment was that the divisions have their individual missions and goals, but maybe we have an opportunity to collaborate across divisions, and that would be really, really welcome. So then the next slide I wanted to talk with you a little bit about was some of the feedback we got on how people perceive teamwork in HSA. So the vast majority of the employees strongly agreed that health services agency teams are very effective. And you can see the kinds of questions that we asked there. And again, that was really, really good to hear, except sometimes what's even more informative than those 5-point scales are the comments. So some of the comments that were helpful in this area were that in some areas of the agency, people feel like they have really heavy caseloads, that management could be improved, and a lot of different factors are contributing to burnout of the staff. Other staff had said that they would like to see better opportunities to work across silos and share information and resources, both within their own divisions, but also across divisions. And then another really good theme that came out of this in terms of the comments was wanting a better understanding of our common goals to serve the community, in a hope that it would help change our culture so that the administration side of the house could be more supportive of some of the programmatic needs that were out there. So again, that employee survey is a tool that helps give us the lay of the land for our planning landscape. The other tools are the various strategic plans that we have within the agency. We have a public health strategic plan that I love the vision, better health every day for everyone. And as you can see, the mission and values are really closely aligned with the agency and also the countywide ones. There's a lot of commonalities, and I think you'll see themes of common values across all of the planning work that's done in the county. We also have a mental health strategic plan, and the Behavioral Health Department had conducted an extensive needs and gaps analysis during phase 1 of the planning process, and these were the basis of priority focus areas that came about in part 2. And the priority focus areas were enhancing programs and services, improving communication, collaboration, and community education, and finally, address program staffing issues. So again, really good and important, meaningful work that was done to help inform our broader agency-wide strategic plan. The last agency strategic plan I'll go over is the Alcohol and Drug Program Strategic Plan. And as you can see, the vision statement is really overlaps the vision statement that you've heard in some of our previous plans, a safe and healthy community where individuals and families thrive in a supportive environment and enhance quality of life. One of the things that I wanted to note outside of the broad mission statements that you see here is that it was noted strongly that reducing stigma throughout the community is a foundational element to achieving all of the outcome areas for the ADP strategic plan. And here you can see the different outcome areas of our alcohol and drug programs. So what I'm going to do is wrap up this section of the presentation, bringing you all back to the county-wide strategic plan. As I discussed before, 6 focus areas emerged out of this process, and this process was really inclusive. I mentioned before that some of you might have been a part of this, but aside from engaging county employees through focus groups and surveys and other venues, there are also community meetings and town hall meetings, key informant interviews, and focus groups with other county stakeholders. So a lot of work went into making sure that the people that we serve and the people that work within the county were engaged in this process. So as you can see in the focus areas, under each of the 6 focus areas are 4 goals. And I want you all to take a close look at each of those goal areas, because when I look at these and I look at the role that HSA plays in helping the county achieve all of their goal areas in their strategic plan, it's clear that there's so much alignment and intersection in the work that we do across every single division of HSA. So what I'm going to ask all of you to do is take a look at what you see there, and under each focus area and each of the 4 goals under each focus area, I'd like you to use the chat box and think about the work that you do. And just start brainstorming and writing comments in the chat box about where you see that the work that you do aligns with or overlaps with some of those goal areas and the focus areas. So for me, I'm looking at health equity under comprehensive health and safety. And the work that I do is so ingrained in ensuring that we have an equity lens to everything that we do, whether it's policies or our contracting or the programs that we pursue or our hiring practices. So that would be a comment that I would put in there. So I encourage all of you to just take a minute to brainstorm, think about the work that you do, and comment on any of these areas that align with and could mutually enhance the work that you do. So already from the first 2 comments that are coming through, it's clear that Corinne Highland, she works in our community health programs and helping people make healthy choices fits squarely in comprehensive health and safety, but I also know that a lot of the work that they do in that area falls under reliable transportation, sustainable environment, and county operational excellence. Sierra, yeah, Sierra's work does fall under natural resources and climate change. I love seeing all these comments come through. And also for all of you to know, your feedback that you're providing in these chat boxes is getting saved in this virtual meeting, because we're using all of this as data to help inform our process going forward. I love it. I love all the comments coming through. Someone just said, I'm not sure where I fall, maybe customer experience. I think every single one of us fall in customer experience. If you interact with members of the public or with vendors or even with other county departments or divisions, then definitely customer experience. Okay, so keep your comments coming, and I'm kind of scanning for any questions as well. This is a point where I can stop and try to answer any of your questions. Galen, have you been scanning the comments?
Yes, and so far they're just addressing your question. I haven't seen any questions come through.
Okay, great. Feel free to ask questions anytime. You don't have to wait for us to ask you. Okay, so with that, so what I've just done, and again, I love all these comments coming through, and keep them coming because they're a good record for us for this planning process. My purpose was just to give you guys, hey, here are all the efforts that are already going on. Here here are the efforts that are also going to help inform or set the stage for our strategic planning efforts in the future. And it's going to be really important to look to the work that's already being done to help develop our next phase, which is shaping our own agency-wide vision, mission, and values. So with that, I'm going to turn it over to Galen. And Galen is going to review the methodology and the timeline for developing our agency-wide strategic framework, and then share how we're going to be engaging all of the staff as much as we can in the next few months to complete this process. Maybe the one thing that I will add is I started out saying this is a strategic framework and it's not a strategic plan. So some of you might be wondering, so when's the strategic planning happening? So we create the framework first, and our idea is once we have a shared vision, mission, and values as an entire agency, and then we start some work on the agency-wide strategic plan, we will be doing concerted effort and work with each of the divisions to help them either update their existing strategic plans or develop ones. And then when we get to that place, we've already done the work of aligning our values, aligning our North Star vision so that things are more collaborative, coordinated, and integrated across the agency. So with that, I'm going to go ahead and turn it over to Galen for what comes next.
Great. Okay, I'm sorry to have to move to the next slide. I know we're still getting some wonderful comments in, and this is really, really helpful data for the planning process. So thank you for all of that. What I'm going to do in the remainder of this presentation is just explain what a strategic framework approach is, which includes these three primary components. Your mission, vision, and values, as Mimi's mentioned, so that's your core purpose, the ideal future state, and those principles that will guide how you work, how you do your work, both within the agency as well as in the community and with your community partners. So that's the first big chunk that we're going to be working on for the strategic framework. Then we're going to be doing what's called an environmental scan, and that's where we're going to look closely at the factors in the environment that need to be taken into account when developing the third piece, which is the priority focus areas. And these are not your specific strategies or programs or initiatives. They're much larger buckets of work that then allow a lot of flexibility. Once you develop those priority focus areas and you have a smaller number of those then each division could be looking at each of those priority focus areas, just like you're doing now. We're looking at the county-wide focus areas. You'll be looking at those and considering how your specific programs align with those. And you'll see what I mean a little bit more as I go through this presentation. And again, I want to remind people, as Mimi has, please send us your questions. Now Mimi's going to be watching our chat pod, and if there's questions, she'll make sure that I answer those if they're about the framework, and then she will answer them about some of the broader process questions. So just quickly, some definitions. The mission, there tends to be some confusion with people sometimes around mission and vision. And that's why I like these really simple definitions. There's many different definitions, but we're going to be working with these just to help create the distinctions. So the mission is your organization's core purpose. So that's what the organization does and why. And then if an organization is successful in achieving their mission, then they should be able to achieve this broader futuristic vision, which is the view of the ideal state or conditions that you aspire to change or create in Santa Cruz County. So this is the North Star that Mimi was referring to. And what you might see, you saw the vision statements that she showed you as some examples already in the county. And those vision statements might be precisely the same across different agencies, organizations, programs, because there may be many efforts that lead to one vision. But the mission statement is a little bit more unique to what is your unique role in achieving that vision. So those are kind of the distinctions between the mission and the vision. And then finally, what's really, really important are the values. So that's basically how you work, how you do your work. So what are some of the guiding principles, beliefs, and underlying assumptions that guide the organization? So that's kind of the how. And so that's the first piece, the first big chunk that we're going to be looking at collaboratively. We're going to be bringing people together in workshops. We'll be doing focus groups, online surveys, and of course, all the feedback that we're getting right now from you is going to go into that process. Then the second, as I mentioned earlier, the second major component is the environmental scan, and that takes place with two different parts. The first being a SWOT analysis. I imagine that some of you are familiar with that term. It refers to strengths, weaknesses, opportunities, and threats. And what we're going to be doing is we're going to be taking a look at what are some of the internal factors or attributes of your organization, of HSA. So what are some of the strengths and what are some of the weaknesses? So that's the internal organizational factors. Then we're going to also be looking at external factors. So those are things in the environment. What are some of the opportunities right now? Maybe there's some funding streams that are new or that are being maintained. Maybe there's a change in political leadership in the community that's going to allow you to do some different things. Opportunities, trends in the bigger environment, could be statewide or national, that affect your work directly. What are some of those opportunities, but then also what are some of the potential threats? So if you're already seeing some changes in funding streams or broader political movements or political will that might be a barrier to achieving some of your policy goals, for example. Or you're seeing, one example is, now we're really seeing this really dangerous threat from the opioid epidemic. So that might not be something that was as big 10 years ago, but now that's something that we do need to address. So we'll be looking at that and getting a lot of feedback through focus groups of staff of what those strengths, weaknesses, opportunities, and threats are. So we'll be collecting that data, and the second part of the environmental scan is what we call a force field analysis. And this diagram just is to kind of show you, we're going to create our own diagram of what those key forces are that are driving change towards achieving that vision, the North Star, getting to the North Star. So those are some of the strengths and the opportunities that we've identified in the SWOT. So what are some of those, and which ones are the strongest? What are the strongest driving forces for change? And then similarly, what are the strongest restraining or resisting forces for change? So those might be some of the weaknesses and threats. What are the ones that are most important to address to be able to achieve the vision? And so that's where the data that we collect through the SWOT analysis then sets us up to be more strategic. That's where the strategic comes into the strategic framework, is where we're analyzing these forces for and against change and looking at what kind of pressure points can we put on those, either to enhance the driving forces or to reduce the restraining forces. So that's the second major component of the strategic framework. And then the third would be, once we've done that, then looking at what are those priority focus areas. Again, those broad buckets of directions or proposals that will impact your ability to achieve your vision. So these would be using the strengths and opportunities that you've identified, and then overcoming some of the restraining forces that you've identified. And that these priority focus areas will have the best potential of catalyzing movement in the direction of your vision. So that's the last major piece of the strategic framework. And as Mimi mentioned, there are some things that are missing. Probably a lot of you have done strategic planning before, and what this does is, again, set up a framework for then, once you have that, then you can be looking at your specific goals, objectives, activities, strategies, and programs on a more regular basis. So the framework can be long-term. You can have a framework that is still relevant 5 years from now. But oftentimes, organizations will think, okay, strategic planning, 5-year strategic planning, they'll do as far as I just covered, plus their goals, objectives, activities, work plans. But that doesn't leave you nimble and flexible. And as we mentioned, when you look at the environment, it's changing really quickly. The funding environment changes, the political environment changes, social norms change. There's new emerging issues that come up. So the beauty of this approach is that you can have a pretty solid, up to 5 years or so, long-term strategic framework, and then each of the divisions can be using that framework to be doing ongoing strategic planning, so that where you can update your specific goals, objectives, and strategies each year, but your framework stays consistent, at least for a period of time. So how are we going to go about developing that framework? This is a timeline that we're working with. So right now, obviously, it's early March, and we are doing these virtual presentations. We're doing 3 of them. This is the second of 3 this week. And the purpose of this, as you know, is setting the stage for creating the framework. So to make sure everybody's on board, people understand what the process is and where those points of input are for staff. And then the first workshop that we're going to be doing is already next week. So our team will be there in Santa Cruz from March 12th through the 15th. We're doing 4 workshops. And in those workshops, these are small groups. The virtual, we can do a lot more people. But again, as you can tell, it's very one-way. In these workshops, they're going to be smaller. There's going to be 4 workshops with about 25 people in each of those. And I know that managers and supervisors were invited. I guess there's quite a few. You guys have 600 employees, so we're trying to figure out how to do these interactive, hands-on workshops, but also engage as many people as possible. So we're going to be engaging about 100 people in these workshops, but this is just part of it. What we're going to be doing in the first one is we're going to do some consensus building and developing the mission, vision, and values statements in each day, and then building each day towards finalizing these statements, creating drafts of them, and then the next thing we'll do is send out these drafts, and some of these may be really rough drafts, or even possibly multiple versions of a mission, vision, or value statement that, for all staff to weigh in. So everyone will then get an online survey in early to mid-April, where you'll be able to look at what the work was done in those workshops, provide some feedback. If we have multiple versions, we might have you rank them, and then plenty of opportunities to provide input on the wording, or if there's certain concepts that are missing from them, etc. So you'll have an opportunity to weigh on those. And then we will start collecting the SWOT data through focus groups. So we're planning on having 10 focus groups in late April and early May. And we want to make sure that the people who participate in the focus groups are not the same people that are going through the workshops. So again, we're trying to spread this out so we can get as many people engaged in this as possible. So we're looking at about another 100 people to be participating in these focus groups where we'll be discussing the strengths, weaknesses, opportunities, and threats, and collecting your input on that. And then that data will then be brought forward to the same group that was in the Mission, Vision, Values workshops, the end of May, right after Memorial weekend, that Tuesday through Friday, we'll have 4 more workshops where we'll be doing this force field analysis. We'll be looking at the SWOT data and then analyzing how strong these different driving and restraining forces are. And then the second part of that day will be to come up with draft priority focus areas. And then once we get all that information, we will be drafting a strategic framework that will then go out to people for feedback once again. So that'll be throughout June and July. And once we have the final strategic framework, then we're looking at the fall to apply that strategic framework to each division's strategic plans, either updating what strategic plans you have or developing plans within those divisions. So I'm going to go ahead and leave this slide up. If there's any questions for me about the strategic framework process or for Mimi, we certainly have time to address those now. So Mimi, were there questions that I missed while I was talking?
There are, and actually I started typing, but it's probably easier for me to talk. So
Okay.
There was a question from Delia about have participants for the workshops been chosen. So the mission, vision, and value workshops, we're trying to figure out how to get as much participation as possible. And so we broke it up into buckets to those all-day workshops and then focus groups and then surveys, all around elements of mission, vision, and values. But to try to keep it manageable, because it's an 8-hour, each one of those mission, vision, values workshops is 8 hours, and I'm at all of them. And then we knew that we wanted every manager and supervisor there, and there's 100 of them. So we had 3 mission, vision, value workshops and invited the managers and supervisors. But yesterday's virtual meeting, we got feedback saying it's really important for line staff to be at those as well. And we had thought that the way we would get the line staff involved is through the focus groups and everything. But we're going to try to figure out, and it's late notice because it's next week, but we do have slots left in the Thursday and Friday sessions for the mission, vision, values workshops. So if there are any people that if you're not a manager and supervisor, you're welcome to attend, and we'll fill up those slots with anyone. And we actually want a diverse group of people, from whether you work in administration or you work in Watsonville Clinic or wherever. We would really like that. And again, it's an all-day 8-hour workshop, and there are 3 of them next week. And I know it's a lot of time, but if you're interested in it and we could find coverage for you, I'm happy to figure out how we can make you do that. So if you could just get back to Jessica Randolph, I hope that's okay with you, Jessica, for anyone that's interested in one of those spots. And then if you're not able to make the virtual focus groups, the idea is to find people who have different kinds of jobs across different areas of the work that we do to, again, get different voices coming together to make sure that we engage our entire workforce as much as we can in the different elements of this. I don't know if that answers Delia's question. Okay, Jessica just put up her information. So, and then kind of unrelated to today's presentation were a couple of comments about sustainability and all of that. So there is a lot of work going on in the county-wide strategic plan. And so what's happening right now with the county-wide strategic plan is they're operationalizing it. And what that means is they're picking like goals. And under each goal area, they're picking objectives that are SMART, so specific, measurable, attainable, relevant, and time-bound. And so I sit on, there is a county committee for every single one of those 6 focus areas, and I sit on 2 of the committees. And I don't sit on the sustainable environment one, but I know that there's a countywide committee of like department level people that are working on working across all the departments to develop objectives. And I know that there is an objective around recycling and being more sustainable. And even if it's not a part of our HSA strategic plan, which we don't have right now, we're part of the countywide strategic plan. So there are many elements of operationalizing that plan that every department is a part of. So I encourage people who feel like that's a part of operational excellence as well as just responsible government to stay involved in our own strategic planning process because it rolls up into the countywide strategic plan. Let's see, what other questions are there? Okay, we did answer Delia's question. So yeah, I don't see any other questions. I think we're good on that.
Somebody else is typing. We just wait just another minute if there's any other questions, and then we're going to actually ask you for some feedback before we close. So go ahead if you still have questions. I'm going to go ahead and move to the final screen. And here you still have those files if anybody wants to download anything that you've seen in the presentation. The first one is the presentation itself, and the rest are the different plans that we referred to. And all you have to do is just highlight, click on whichever one you want to download, and click on Download Files. And then if we run out of time and you haven't been able to do that once we close, you're welcome to get in touch with Jessica if there's specific documents that you'd like. And I know Mimi talked about putting it on your, what do you call it? The
intranet, the HSA intranet.
Intranet, that's what it was.
Yeah.
Okay. So before we end, and now the chat pod is over to your right on the bottom, if we could get some feedback from you, that's really helpful. The feedback yesterday really helps us improve the process today. So what worked well in this presentation, this virtual presentation? And then we really appreciate any suggestions you have for improving the process. So if you could each answer both those questions, we'd really appreciate it.
So I was going to type the answer, but I think I'm just going to answer Gary and Robin. So Gary and Robin, and also when you're entering in the chat box, if you're answering the questions, what worked well, and suggestions for improvements, you have to do it in those boxes, just as a reminder. So Gary and Robin asked questions like when will line staff workers be notified, or how are they going to be included? And then Robin thought it was important to get all levels of staff input. I totally wholeheartedly agree. So what we're trying to do is the next, there's another opportunity, and it's through those focus groups. And those focus groups are interactive and back and forth, getting a lot of feedback from staff. So we have room for 100 people in those focus groups. We're doing 10 of them and having 10 people in each one of the 10. This is a lot of work, but it's important. So I think what we're going to have to do is work to figure out how do we get the best representation for line staff and staff of all levels to be a part of those focus groups. And I think that our goal was, since the all-day workshops were primarily supervisors and managers, that we would try to find some way to ensure that we reached across all areas of the agency for the focus groups. Oh, so the workshops are going to be at Simpkins. The in-person workshops are going to be at Simpkins Swim Center, and they're next week, and I believe they're all day. Is it Tuesday, Thursday, and Friday? And you only have to attend one.
Tuesday, Wednesday, Thursday, and Friday.
Oh, there's 4 of them. Tuesday, Wednesday, Thursday, and Friday. That's right. We're trying to get 100 people in. And there's room Thursday and Friday. And then for the focus groups, they're going to be virtual. So this platform that we're using, you can also all talk to each other. We just didn't use that feature because these virtual meetings sometimes have between 50 and 95 people on them. The focus groups are going to be 10 people being able to walk through some really interactive guided discussions with Galen, and those will be virtual, like this kind of thing. but we'll all be able to talk to each other. Oh, oops. They're not at Simpkins. They're in the auditorium. Oops. Thanks for correcting me, Jessica. Just for those of you on the other side, I feel really weird like talking at everyone. I feel like I'm in this box all by myself. But it's nice to see your comments because I realize I'm not alone.
And so for those of you who are still writing, we want to encourage you to take the time to give us the feedback. We would love it, and especially seeing those pods fill up makes us not feel so lonely, as Mimi said. And also just wanted to point out, if you've already finished, you can use, there's a scroll bar on the side of the each chat pod, so you can independently scroll up and down if you'd like to review other people's comments.
Yeah, and the comments are actually really, really helpful. And some of them are similar to the comments that we got yesterday, and we've already tried to course correct for some of the logistical and technical things. It's all a learning experience for us. And I see one comment about meeting as a group. Actually, yesterday, a bunch of people did that, where they would all gather in one place. And there was a group of ISD folks who just put all their names across, and that was kind of cool. So I like that feedback, and I appreciate it that that it's possible to also have people participate in groups. We really appreciate all of these comments. They're really helpful for us to understand where we need to make some process improvements. And just earlier today, Galen's team sat down, or had a call with Jessica and I to go over all of the feedback and the evaluation from yesterday's meeting. So really, I want to express my appreciation for not only your participation and your presence, for your understanding for anything that didn't work well, and for our commitment that what you tell us is important because it helps us improve our process. And Galen, I know you want to keep this open for a few minutes to allow people to complete their comments, right?
Yeah, so I can leave it open, and our staff will stay in the room, and those of you who feel complete with it, and you've seen what you need to see, downloaded what you want to download, you're welcome to leave the meeting room. And I just personally wanted to thank everybody. Like Mimi said, this kind of feedback is so critical and helpful. There's a lot of data here that's going to help with the planning process, as well as improving our ability to do these kinds of virtual meetings. So thank you, everybody. And like I said, I'll leave this open for a few more minutes until I see the comments start to really wind down. And everybody else, just enjoy the rest of your day.
And I wanted to echo that. I just wanted to express my deep appreciation for every single one of you for showing up, not only in this virtual meeting, but showing up in your jobs and taking the time to listen to us and be willing to be a part of this process. I think it's really, really important for all of us to act together as one unified voice. And again, my deep appreciation for you all being a part of this, and there's more to come. Oh, there is one question. It sounds like it's an 8-hour workshop or nothing. No, there's actually going to be the focus groups as well. So the workshops are for developing our mission, vision, and values, and then there's other iterations of that that include less personal kind of survey formats so that you can provide your kind of vote or comments on things. And then there are the 1 hour, I think they're 1 hour, 10 1-hour focus groups of 10 people each. We're all kind of limited on like time and availability, so we're trying to figure out the best different kinds of ways to get all 600 people included. So again, if you're one of those people that want to be part of the workshop, let Jessica know. But if not, I think you can also let Jessica know that you'd like to be involved in one of the focus groups, the 10 1-hour focus groups. And thank you, everybody. So I have a 3 o'clock meeting, so I'm going to sign off, Galen. I know this still stays on after I'm gone. And thank you all for giving us an hour of your time. And I encourage all of you to keep keeping involved in this process because we need your voices. Thanks all. All right, bye.
Thank you, Mimi.